We're here to create hope and restore lives. Nearly 48 million Americans, that's about 1 in 6 of us, are living with a substance use disorder related to drugs and alcohol, often with co-occurring mental health conditions.
What we're seeing is without precedent in US history. We're losing tens of thousands of lives every year to drug overdoses. This epidemic knows no boundaries. It's cutting across demographic categories including race, age, gender, socioeconomics, although some populations are more vulnerable and more disproportionately affected.
At BHG, we care about addressing this crisis, and we've devoted our lives towards studying the science of health. Everyone has their own recovery journey, their own recovery goals, and their own recovery experience, but they'll see marked improvement when they're in treatment.
Once they get into treatment, that's where our job is to help them maintain that hope that things can be better.
At BHG, we are so proud to be part of a solution that is restoring people's lives and starting to get them on a path to recovery, while also limiting the destructive effects of opioids.
The biggest thing that separates what we're doing with the rest of the industry is that we ultimately hold ourselves to a higher standard in opioid care. Everything from our Joint Commission accreditation down to our evidence-based care models to just the whole patient approach.
It's important that we meet the patient in their unique journey of where they are in their recovery.
You know, it's not enough just to get a pill. Getting stable in your lifestyle, getting stable with your health, enables you to begin to do the often difficult work to figure out how you got into this position to begin with.
The integration of medication-assisted treatment, behavioral health counseling, as well as intensive case management services is the true evidence-based model.
Luckily, we have decades of research of what works in treatment and what doesn't work.
We've been very focused on taking the evidence and our comprehensive approach to treatment and scaling them in a modern healthcare infrastructure so that patients have access to the highest quality care in their communities.
We treat over 42,000 patients every day. So I think that having that scale really allows us to identify those best practices, and then we leverage that across the country. It really elevates the level of care for opioid use disorder and all addiction. The one thing that I think about often, and I hear from our patients, is that many doors have been closed to them through family, friends, or communities. And so I'm proud of the fact that our door is open.
BHG strives to reduce and remove financial barriers to treatment. We're in network with most major carriers, Medicare, Medicaid, commercial.
We're here for recovery, right? I mean, nothing is more gratifying than helping somebody who's looking to get their life back, to help them make progress towards that goal.
There's a deep sense of purpose and deep sense of connection to the mission that really drives the way that we care for patients in our centers.
At BHG, we're all united around our mission and our values. Our values of hope, respect, and caring.
It's such a powerful mission to be a part of, to think about transforming really a community for generations to come.